The COVID-19 update for Simcoe Muskoka. It's been 2 weeks since I last reported, so February the 16th. Since that time, we have surpassed 35,000 cases in total since the beginning of the pandemic. And over half of these laboratory confirmed cases reported to us occurred in the fifth wave. So the fifth wave surpassing all previous waves combined in terms of total reported cases. Today we've reported 178 cases. However, it's important to note that 102 of these are cases from the current week, and the remainder were from earlier in the month. We were doing some what we call data cleansing, catching up with data entry. Just important to note that we've not seen otherwise a sudden jump in cases. When we look at the fifth wave, it stands out in a number of ways. So certainly the highest number of cases, higher than all previous waves combined. The second highest incidence of deaths or mortality rate. So only the second wave at a higher mortality rate. So we've had a mortality rate of 20.8 deaths per 100,000 population cumulative through the fifth wave, compared with a 23.6 deaths per 100,000 population through the second wave. Our current weekly hospitalization rate is 26, which is equal to 4.2 hospitalizations per 100,000 population. So we've had the highest hospitalization rate in this wave compared with any previous wave. And the same, we would note, the ICU rate that we've had, admissions to ICUs in this wave has been higher than previous waves. We presently have a weekly incidence of cases that's only slightly higher than the provinces, so very close to the province's incidence. And both we and the province are now below 100 cases per 100,000 population per week. So that's considerably lower than what it had been at the height of our fifth wave, though still high in comparison with where things have been when they've been low in the past. So in previous waves, we were concerned about anything that was above 40 cases per 100,000 population, certainly above 100. So we're now just below 100 cases per 100,000 population, specifically 92 cases per 100,000 population per week. Or in terms of numbers, 568 cases for the week of February 20th to 26th, compared with 695 cases for the week of February 13th to the 19th. So a decline, an 18% decline in fact, compared with the province, which came down 9% to 91 cases per 100,000 population. So we're at 92 cases per 100,000 population per week, and the province at 91. When we look at our cases, the majority of them had indeed been vaccinated. So 71% had 2 or more vaccinations, and 26% were unvaccinated. 3% had been partially vaccinated, a single dose of vaccine. What's really important to note is that even though the majority of our cases have been vaccinated on an individual level, the risk associated with not being vaccinated is high. You quite substantially reduce your risk of severity by receiving vaccinations. So Those who are unvaccinated are 4 times more likely to be hospitalized and 8 times more likely to be admitted to the intensive care unit and 3 times more likely to die. So it's still very important for people to receive vaccination, and in particular, helpful to receive a booster dose. It is that much more protective. So the figures that I listed for you were with regards to people having 2 or more doses of vaccination. Our percent positivity actually went up slightly over the last week, so it had been coming down week on week since the peak in January from the 5th wave, and in the past week it went up slightly to 9% versus 8.5% the week before. And just a reminder, this is the percent of our tests that come back positive. And this is an indication both of the transmission in the community and also the availability and sufficiency of testing that's being done. The province is slightly higher than us at 11.4% and down from 14.1% the week before. In terms of hospitalization, we are moving in the right direction. We're down to 27 hospitalizations among our citizens in Simcoe Muskoka, compared with 43 admissions 2 weeks ago, and 5 people in the intensive care unit compared with 12 the week before. So we have had 29 additional deaths over the past 2 weeks. I would like to express my condolences to the family members for your loss. And this takes us above 400 deaths in total since the beginning of the pandemic. So we're now up to 412 deaths in total. So the ages of the individuals involved range from under 20 to in their 90s. And we had reported in the past, the media had picked up in the past on a death that we'd had of an individual who was under the age of 20. So that is captured in the figures that I've just given you now. 18 are male and 11 female, 3 from Muskoka, 26 from Simcoe County, and 5 are associated with the institutional outbreaks. The remainder is not part of institutional outbreaks. We are seeing a decline in our outbreaks. So we presently have 18 outbreaks, and we are only monitoring throughout the 5th wave, the Omicron wave. We're only monitoring outbreaks in congregate settings and hospitals, long-term care facilities, child care centers, group homes, but not in other settings such as in businesses. So it's important to keep that in mind. So with that in mind, we had 32 outbreaks 2 weeks ago. We're down to 18 outbreaks now. 3 of these are in congregate settings, down from 4 2 weeks ago. And when we look at the congregate settings, 1 was in a shelter and 2 in group homes. In terms of institutional outbreaks, we're down to 8 from 18 2 weeks ago. 2 are in hospital units, 1 in a correction facility, and 3 are in long-term care facilities, down from 9 2 weeks ago. 3 are in retirement homes, down from 7 2 weeks ago. 7 are in childcare settings, down from 10 2 weeks ago. We continue providing vaccination. Certainly, the volume of vaccination is down greatly from the peaks that we've had in the past. So both during the spring, summer mass vaccination with first and second doses, and early in December when we were providing booster doses, we were up to 10,000 doses in a day, and now we're well under 1,000 doses in a day. We are continuing to provide vaccination at our community immunization clinics, but also doing outreach to schools as well to help boost coverage for children 5 to 11 years of age. So with regards to third doses, which is really, really important, that people get their third dose. We have very good coverage for first and second doses, up to 86% of the population that are 12 and above with a second dose. But with regards to third doses, for those who are 12 and above, we're at 52%. So we have a long way to go to provide that additional protection that comes with that third dose. Protection against hospitalization and to some degree protection against transmission as well, which you really can't get or rely on with just 2 doses with the Omicron variant. And people who are 50 or and above are at a particular risk of severe outcomes. And so it's particularly important that they get their third dose. We have 51% of our population 50 and above that have had a third dose, 83% of those who are 70 and above with a third dose. So we would like to see higher coverage yet in those age groups, but really for all who are eligible. And for children, we remain at 48% of those 5 to 11 years of age having received their first dose of vaccine. And we have lots of capacity to be able to provide vaccination for children as well as for adults and youth. We are continuing with the vaccination in the schools. So we've, on February the 28th, we held 8 school clinics, and 7 occurred on March the 1st, a total of 240 vaccinations provided. So certainly doing the outreach to these locations, getting some uptake. It's helping to provide protection for the children that come forward. We certainly have the capacity to provide more in those settings, and we'll continue with that. With regards to wastewater surveillance, looking for evidence of transmission of COVID-19 in the community, we monitor 4 of our communities, and data on the province and its regions is on the Ontario COVID Science Advisory Table's website. So that is a very good resource to people to look at that. That is a good early warning system for us. We will see some potential evidence of transmission or rise in that signal from wastewater before we would see it in terms of reported cases, and certainly before we would see it in terms of hospitalization. So that is something that we're now watching across the province. And as I said, we have 4 communities, Barrie, Collingwood, Midland, and Orillia, that are participating in this, and we do have that data on our website. We have noticed a jump in a single report most recently from Collingwood. We get samples once a week, and so we're going to be looking for the next sample for Collingwood to see if that is repeated or not. So I do note that. Otherwise, the other communities we've seen a plateauing of their signal at a level that's considerably less than the height in January, but high compared with earlier in the pandemic. And for our monitoring dashboard, we remain in red status due to overall high transmission, high percent positivity, high outbreaks, and high bed occupancy in hospital, and an inability to report on the public health capacity indicator as we aren't doing the same follow-up of individual cases that we were before the Omicron wave. So as of March the 1st, the province has moved to its next step in reopening, having lifted capacity limits in all venues, and gathering limits having been lifted, and also proof of vaccination required by the province lifted, it's important to note that businesses have the option to continue requiring proof of vaccination for their patrons. The advice generally given is that they should seek legal counsel with regards to the application of that. But that would be a way for them to continue to seek to safeguard their business premises for their clients and for their staff. So I think it's important to note that we still have a significant amount of transmission happening in our communities, and people need to be aware of that and to make their own risk determination about participating in venues, going to venues that are at full capacity. We are still required to wear masks in such settings, though I understand that the province is reviewing timing about that and how much longer that would continue. But without the capacity limits, you don't have the same distancing in these settings. And so the risk would go up, and it would be for people, I would advise to determine that as a risk and decide when they would like to participate in that, to the degree to which they would want to, or whether they would decide that they would not at this time, or to only very limited degree participate in such. And it's really important that people continue with the multi-layered approach. So seek and obtain all vaccination dosages that you're eligible for as soon as possible. Continue using masks in these places required and in work environments, but also in other social settings or outdoors where you cannot distance and don't feel safe. It's up to you to determine the size of groups that you're going to be socializing with indoors. The smaller the group, the safer. A dedicated small group would be safer. Outdoors is always safer. Having good air circulation. It's certainly still the cold months, so hard to open windows, but when that becomes more of an option, that would help as well. And monitoring for symptoms using a provincial screening tool for monitoring for symptoms would be important, and isolating if you develop symptoms or if you learn that you are a contact of a potential case to help safeguard yourself, safeguard others from exposure and becoming a case. That remains important, all of that. We still very much have ongoing transmission at fairly high levels in the province and in Simcoe Muskoka. So it's really for people to take all of that into account for themselves. And same in the workplace as well, to exercise the precautions, these kinds of precautions for yourself in the workplace as well. So through the pandemic, from time to time, I've issued letters of instruction. And the most recent one was dated November the 23rd, 2021, which is now being lifted and rescinded as of March the 1st. That letter of instruction had required proof of vaccination for coaches and volunteers working in indoor sports and recreational facilities. With the province's new regulation, that letter of instruction is automatically lifted. So I've communicated that out. I would also say, though, that these premises do have the right to continue to require proof of vaccination for their patrons, for the volunteers, such as coaches, if they so choose. We recommend that they seek legal counsel, but that would be something they could consider doing to reduce risk. I would also say that I have advised employers to consider having workplace policies about immunization to safeguard the work environment for their employees and other workers and volunteers. This wasn't binding, but it was advice. And I am presently updating my recommendations with regards to that to be issued soon. But it will remain advisory, not a requirement. So as I've indicated, vaccination is still very important. Third doses, very important for those that are eligible. And basically, we're looking at 12 and above would be eligible for third doses, booster doses, particularly important for older people, people above the age of 50 at a much higher risk of severe outcomes. There's quite an additional level of protection with a third dose, a booster dose, compared with 2 doses for severity as well as transmission. So important that people take full advantage of that. And it's just over half of our eligible population that's actually received that. The availability of this is still at our clinics and our community clinics, some pop-up clinics that we are establishing, the GoVax bus, and people can book that through link on our website to the provincial booking system. Also participating pharmacies, and we are accepting walk-ins as well at these venues. And same for children 5 to 11 years of age, encouraging first and second doses and making them available at our walk-in clinics, and also having clinics take place at our outreach at our schools. And people can see the schedule for that on our website. We've made some changes for our health stats data. This is something we've had to modify going forward over time as the completeness of our data set has changed, particularly through the Omicron wave. So at this point in time, one thing we would note is that we've made changes to the monitoring dashboard page, viral spread and containment section due to, and I've replaced the adjusted effective reproductive number, 7-day moving average, and percent of new COVID-19 cases acquired in the community, previous week average indicators with the new COVID-19 deaths, previous week total, and new COVID-19 ICU admissions, previous week total as indicators. So we're basically replacing it with more reliable indicators with the data, given the data set that we have. And also that they align more closely with the province's key metrics. We've also made changes as of today with regards to the wastewater surveillance page. So we formally had both the level of detection of wastewater for each of the 4 municipalities, and on the same graph, correlating that with test result positivity, a number of positive cases, and we're replacing that with regards to hospitalization levels for those communities instead, as more reliable indicators and more aligned with the provincial indicators of interest. So I've had the following question from the media. Wanted to check to see if there's been any info yet on ramping down permanent clinics, as York Region appears to be doing. Their communications people told us they're moving through a 6-week, 4-phase demobilization transition plan that includes adjustments to hours of operations and staggered closing of mass vax clinics, opening smaller clinics, and expanding mobile outreach. And any update here, what I would say is that indeed, we have to look at this given the low level of ongoing uptake vaccination, adjusting the number of personnel working in our clinics, and looking through this month, later in the month and beyond, as to potential changes in this regard. But I don't have any specifics for you at this time about this. So certainly we'll communicate upfront about it as we know. So at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. We will now take some questions from the media. Just a quick reminder to please limit yourself to 1 question and 1 follow-up in consideration of time. Can we start with Erica Engel from Collingwood Today?
Hey, thank you. Dr. Gardner, one of the things I'm getting is that you might think that some of the lifting of restrictions was a little too early, province-wide, and you can correct me if I'm wrong on that. But Dr. Moore has said the proof of vaccination was really only protecting the unvaccinated at this point, especially in because it's 2 doses, not 3. So I just wondered, if you do think the lifting of restrictions were too early, what role were they still serving? Yeah.
So specific to proof of vaccination, because that wasn't the only thing that was lifted. There was also some capacity limits and gathering limits that were lifted. But with regards to proof of vaccination, I believe that that was very helpful to us when we had the Delta wave, the 4th wave, because at that time, with that variant, you had a high degree of protection against transmission with 2 doses of vaccine. And then we had a change, of course, with Omicron, in which 2 doses did not really provide protection against transmission. It provided quite a high degree of protection against severity, but not of transmission. 3 doses provides some degree of protection against transmission and even a higher degree of protection against severity. But the proof of vaccination requirement was for 2 doses. And so I would agree that what remained during Omicron with that requirement was protecting those who hadn't been vaccinated from being exposed in those environments and having a severe outcome. That is certainly an important goal, but it's not the same as the other goals that were being achieved formerly. The goal of reducing transmission in the first place, I don't believe was actually being achieved with Omicron during the Omicron wave with the proof of vaccination program. So I believe going forward, the province needed to decide, what they would do with that. They've decided to lift it. One other option would be to require a 3rd dose instead, but that would be a difficult transition to make, considering that almost half of the eligible population for a 3rd dose had not actually received it. So they've made the decision that they've made.
Okay, and what about capacity limits? Is it your view they should still remain in place then? They still
I has indicated before that I felt we should take a measured approach and not rush. The province was originally looking to mid-March to make that final step. That would have been that much more precautionary, would have allowed for that much more of a slowing of transmission instead of perhaps the plateauing that we're starting to see. It would have helped to prevent some people from becoming cases. And in the end, the government has to weigh many things, not just the pandemic, not just transmission. They have to weigh other factors as well. So they've made a different decision.
Thank you.
I would put forward, though, my positioning about people needing to be aware that there's still quite a high transmission rate and that they need to decide for themselves the level of risk they're going to take on by going to public venues in full capacity and determine whether or not they will actually do that, will actually take on that risk. One way to reduce risk on a personal level is to be very judicious about that or selective about how much of that they would want to choose to take on.
Thank you.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question this afternoon?
No, I think Dr. Gardner covered everything I needed to know. Thank you.
Great, thanks. Chris Simon from Bear Advance, do you have a question?
Of course. Hi, Dr. Gardner. If the indicators of transmission continue on their current trajectory, would you entertain the idea of lifting mask requirements in a couple of weeks?
So thank you for the question. And the requirement for masking is provincial. It's in provincial regulation. It's true that early on in this early summer, late spring, early summer of 2020, I put in place a letter of instruction requiring face coverings, and that was ahead of the province. A number of medical officers of health did so at that time because of the emerging evidence about the importance of that. But we now actually don't have the ability to issue a letter of instruction towards that end. That has been lifted as well within the changes of the regulation of the Reopening Ontario Act. So that's not something that I can readily do. I can't do it with the Reopening Ontario Act.
Sorry, maybe I should be a little bit more clear then. Do you support the idea of lifting mask mandates if the current transmission rates continue along their trajectory?
To me, mask use is important because it is relatively easy to do without a cost to businesses and reduces the risk significantly for transmission. And we still have quite high transmission. It's come down a great deal, but it's still quite high. And so for something that is safe and easy to do, I would be advocating that it be continued for a considerable time to come. We'll see what decision is actually made by the province, but I believe we shouldn't actually be in a rush to remove it.
Okay, and if you don't mind, maybe I'll steal one of Mary Beth's questions here. But by my count, the health unit has issued 39 fines related to non-compliance of businesses over the course of the pandemic. Looking back, especially when you see that York, for example, just sent out something today that, in terms of the number of businesses that they've fined, was the health unit's approach the right one to take in terms of trying to contain transmission in workplaces?
I must admit, I haven't seen York's release, so I don't have a sense as to the numbers. They are quite a bit bigger as a health unit than us, so I think you'd have to take that into account. I could say that we have had throughout the pandemic, I guess one way of looking at this is the level of transmission. And on the whole, it's been low. Through the Omicron wave, it was about the same as the provincial rate. And late in the Delta wave, it became high, but otherwise it was low in the range of about half of the incidence per 100,000 population, about half of the mortality. So we've done all that we can with the resources that we have to achieve that outcome. And part of that is working with businesses to have compliance, to have safety practices. Issuing fines is one way. Education is important to be done as a step before you get to issuing fines. And we've used our resources to our very best ability, certainly put a lot of effort into keeping up with advisory documents on our website for businesses, hosting virtual meetings with the business community, and taking calls from the business community to assist them with their compliance and their safety.
Thank you.
You're welcome.
James Bowler from Cogeco, do you have a question this afternoon?
Yeah, thank you. Just going back to the mask discussion, Premier Ford has alluded to the fact that we'll probably see masks removed after the March break. I'm just wondering, from your perspective, you've kind of already said this, but are you ready for that? And if you're not, will you look at, alternative means to kind of keep some protections in place?
I believe that we should be continuing with mask use. And I don't believe that doing so in the month of March would be the safest thing to do for the public with the amount of transmission we have and the fact that evidence supports the effectiveness of mask use, along with the other measures, hand washing and distancing and self-monitoring, isolation, vaccination. It's an important component of all of that. I don't have the authority or power to issue a letter of instruction anymore, and medical officers of health don't have that. We can engage with the Office of the Chief Medical Officer of Health for such from the Chief Medical Officer of Health if we feel we have local circumstances that warrant it, but we don't otherwise have that power. And I will continue to advise that people voluntarily use the protective measures at their disposal, even after the requirement for them has been lifted. So that would be the case with mask use as well.
So what, in your mind, I guess, is the worst case scenario here that could happen if from what you're saying, we go too early to remove these precautions?
Well, at the beginning of February, the Ontario COVID Science Advisory Table had issued modeling that suggested the potential for a resurgence of the Omicron wave. As time goes on, that appears to be less and less likely, or that if it does happen, it'd be less likely to be severe. But undoubtedly, as we move away from protective measures, the risk for individuals contracting COVID goes up. More people become exposed and become cases. So on an individual level, there would be additional cases that would not have occurred otherwise.
Thank you.
You're welcome.
Mark Claremont from Muskoka Today, do you have a question?
Yes, thank you. Following on the mask theme, Dr. Gardner, because people seem to have largely tuned out in recent weeks, they think that the COVID is much over there. Could you clearly state where the mask policy is? Only indoors and not outdoors? And if I could just add a corollary there, what is the current thinking in the medical community regarding exposure? Because you spoke to the fact that people have to gauge their own risks there. And so there used to be a thought early in the pandemic that 15 minutes exposure to somebody who has the COVID, that's where the real risk is, right?
Yeah, so thank you for the two questions. With regards to masks, they are still required to be used in indoor public places and workplaces. And we still advise that people wear them in a private setting where they are concerned about transmission with individuals that they feel they themselves may be at a higher risk of severity if they contract COVID-19. It's always something they can do to reduce their risk. And same with outdoors if they can't physically distance 2 meters. So there's a requirement versus what we would advise. What we'd advise being more encompassing than the requirement. With regards to exposures, indeed, we were through most of the pandemic considering 15 minutes of exposure within 2 meters to be a significant exposure. And strictly speaking, that's still the case, although with Omicron, it could very well be considerably less than that. Also, what's of importance is whether or not there's good air exchange, whether or not this is indoors versus outdoors. Or a small confined indoor space being a higher risk location. So those other factors could indeed shorten the duration of exposure necessary for transmission.
So passing people on the street, walking down the street, or in a public venue, you're not generally exposed that much or anything like that, right?
An outdoor exposure, passing somebody on the street momentarily would be still considered a low risk exposure. The more of that you do, if you do that in a large crowd, even in an outdoor environment, could carry some risk.
Okay, that's fine. Thank you very much.
You're welcome.
Do we have any questions from the phone line today?
I do, actually. It's Adrian. Just a quick question about removing the masks and the flu, or the flu vid, whatever it's being termed now. Are you seeing much of this year?
So since the beginning of the pandemic, the incidence of influenza and most other respiratory infectious diseases has plummeted to a very, very low level, which is a real testament to the effectiveness of the public health measures that we put in place, and also speaks to just how much more transmissible COVID-19 is. If the mask use, the distancing, the capacity limits, the hand washing, messaging, the isolation of cases, people with symptoms has almost completely stopped influenza transmission, but had limited impacts on COVID-19, then clearly COVID-19 is much more transmissible than influenza.
So I know that the flu shot has been made available. Are people getting it? Should they be getting it this year? Is there any point to it this year? Should people be waiting? Should they skip a year this year and just focus on the COVID shot?
So I always advise people to take vaccinations that they're eligible for. And the period of intense interest and promotion for influenza vaccination is usually for high-risk people October, and then into November and into the new year. It's available throughout the winter season, and the influenza season typically can carry right through to April. So for people who've not had the flu shot this year, I would advise that they get that even now, even though the risk this year is low. With the lifting of the public health measures for COVID-19, we might see an increased risk and increased transmission of influenza as well. So that would be another reason why those who've not yet gotten their flu shot this year do so.
Okay, thank you.
You're welcome.
Are there any media outlets who didn't have the opportunity to ask their question this afternoon?
Yes, I have a question. Caitlin here with CTV. I'm wondering if the recently approved vaccines will be available in Simcoe Muskoka.
We're awaiting Novavax. It'll probably be late March. Medicago has had approval with Health Canada, we've yet to receive advice on its use from the National Advisory Committee on Immunization, and we don't have a clear line of sight yet as to when it would be available.
Okay, thank you.
You're welcome.
Was there anyone else who didn't have the opportunity to ask their question?
Hey, Kara, would you mind if I asked another question?
Certainly, go ahead, Mark.
That's only 10 after 2 there, so we have a few minutes. Yes, Dr. Gardner, regarding the current war that's going on in the Ukraine, do you know what the current guidelines are federally if people are repatriated or are allowed to emigrate to Canada, what their status would be for COVID and that sort of thing? Is it, I'd imagine everybody'd have to have a vaccines. Is that the case?
I'm afraid I don't have the answer to your question about special refugee status management and federal policy.
Would you happen to know if there's a population in Simcoe Muskoka of Ukrainian descent or anything like that?
My understanding is that there is indeed, and more concentrated in the southern portion of our territory.
Sure. Okay, well, we'll watch that one. Thanks very much.
You're welcome.
And are there any final questions this afternoon? Okay, I believe that brings us to the end of our media briefing today. Dr. Gardner, thank you so much for your update, and thank you to the members of the media for your participation. We will definitely send out a media advisory in advance of our next media briefing. Have a wonderful day, everyone.
Goodbye, everybody.
Recording stopped.
Bye.
Fill out a show proposal and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
You must be the reporter. Come with me.
So, Miss McGill, how does it feel being Canada's famous women engineer?
The real story is the work we've done retooling this factory.
To build the Hawker Hurricane?
Indeed. 40 planes last month with a capacity of up to 100. Our fighters are over England as we speak. Of course, it pains me to see airplanes mass-produced like boxcars or baby carriages. But in war, we make concessions in favor of innovation.
You must feel at home, though, managing all of these women.
I'm not here to manage women.
Well, you must admit it is an unusual job.
I'm the chief engineer here. I do what engineers do. That's all.
What are we doing now?
We are to win this war. We need to know how she flies.
Elsie McGill was the world's first female aeronautical engineer. She oversaw Canada's production of Hawker Hurricanes during the Second World War, earning her the nickname Queen of the Hurricanes.
Welcome back to Hitting Home with Mike and Arif. And Tara Dawn Winstone, local radio personality, has been our guest today, and she's opened our eyes to some of the intricate details of contractor fraud that she's been going through herself. And certainly it's been a lesson for all of us who are watching, and myself and Arif included, what she's been through. And I thought we could take this last segment, Arif, and talk a bit about, it's not just contractor fraud that homeowners deal with. I mean, there's a lot of fraud that takes place, unfortunately, with regards to mortgage and financing and title fraud. I thought we could just talk about some of the other areas of fraud that are prevalent out there. And hopefully we can provide a forewarning for people out there with this.
Sure. So, Mike, let's do one thing. And Tara Dawn is a wonderful person. She's a great person in the community. She's always there to help and use her platform to help people. And so,
for sure,
obviously, it's certainly whenever this happens to anybody, it's equally traumatic. It's equally disappointing. It's equally whatever adjective you want to give to it. The fact that it happened to her, for me, is makes it just an opportunity to share her story, to be relatable to people that she's been relating to on a daily basis for years over her career.
She's not a stranger.
No, she's not. She's not a stranger. No. But